Well, I'm so glad to see you all today. We're very excited to be here and chatting with you all a little bit more. Our title of our presentation is a kind of a little bit general because we're going to talk about a lot in our little hour that we have with you. But generally, we're going to be talking about perinatal mental health, and we're hopefully going to leave you with some tools and some thoughtful points and some data and all good stuff. Oh gosh, no.
We're trying out the pointer.
That was too powerful. There we go.
Hi, everybody. I'm Alex DuBois. I work over at the Butte 4Cs. This is my family. I was born and raised in Montana. I have a husband, and then we have 5 kids together. And then you probably can't see them, but these are my dogs, and one is 130 pounds, and one is 10. They love each other, but it's pretty hysterical to watch them play. So that's kind of a little bit about me.
So yeah, my name is Shelby Anderson. I'm a Potawatomi out of Oklahoma. This is my micro family. I'm soon to be married to this man over here, and thank you. And we met at the University of Montana when he was going to school for teaching, and I went to school for psychology and family and human development. So that is me.
All right, our goals and objectives today, oh my gosh, we don't even have our notes up, is to develop an understanding of the impacts of perinatal mood and anxiety disorders, develop an understanding of substance use and the perinatal period, and then understanding the services available both locally and nationally.
Right. All right, so PMAD stands for perinatal mood and anxiety disorder. The perinatal period is going to be from preconception through 1 year after delivery. This is a pretty crucial period of adjustment after having a baby, where a woman is going to go through a lot of feelings of exhaustion, irritation, sadness after giving birth. But that is typically the baby blues that lasts, about 2 weeks. But perinatal mood and anxiety disorder can go much further than that. So that goes along with depression and other mood disorders during this period, and then anxiety with or without depression during that perinatal period.
All right, so some common signs that you'll see during that are perinatal mood and anxiety disorders. You'll see in depression, low mood, sadness, tearfulness, lack of energy, feelings of guilt, shame, or hopelessness. In the anxiety disorder side, you'll see a constant worry, feeling that something bad is going to happen, disturbances of sleep and appetite. And then on the other side, there's postpartum psychosis, but this is relatively rare and only happens about 0.1 to 0.2% of births. And then the onset of postpartum psychosis is usually sudden and most often within the first 2 weeks of postpartum.
So, we talked a lot earlier about ACEs and, things that can happen early on in somebody's life that can put them at a higher risk of being a part of this category. So I'm going to talk about risk factors in general, and I'm going to break them down into a couple different categories. So first off, some biological risk factors. This is going to be your medical history of depression, anxiety, and depression, anxiety during pregnancy, menstrual pain or PMDD, so premenstrual dysphoric disorder, medical history with thyroid illness, long or short intervals between pregnancies, and then unsuccessful specifically fertility treatment. So a lot can go into that biological risk factors, and that's a lot in your guys' work. So my thumb is too strong for this. So some social and environmental risk factors are going to be your everyday kind of barriers. So life changes, so new homes, new jobs, loss of loved ones, isolation, which I think is a really prevalent thing in Montana. That's just your kind of natural rural environment. History of trauma, domestic violence, systemic racism, substance use, and financial stress, and then barriers with communication. Again, all of isolation, but that's also with family. So then psychological risk factors are going to be your interpersonal stress, unsupportive family members, mixed feelings about motherhood, experiences with trauma, so physical, emotional, sexual, SUD, so substance use disorder in the family specifically, unresolved loss of the family, so that could be death, that could be divorce, low self-esteem, all of those kind of play a huge part.
So PMADs are the number one complication of pregnancy and birth. They affect 1 in 7 women nationally. And suicide rates in women increase 44% during the postpartum period. And then the peak incident of suicide is around 6 to 9 months postpartum. So the question is, and you guys are all experts in a lot of these areas, but why is this happening? And really, it's a perfect storm of changes in biology, physiology, lack of sleep, transition in identity from pregnancy to parenthood, and one's own expectations of parenthood versus the reality of the new baby. So, brain chemistry is changing, and the neurotransmitters are directly linked to the endocrine gland function and the gut health. And our endocrine gland system is the system of hormone producing organs. So when our hormones, especially estrogen, progesterone, and cortisol, don't regulate normally, it can be a major contributor.
So we talked a lot about how this is affecting mothers or the birthing parent, and but really this is a whole family issue. So how can PMADs affect fathers? About 1 in 10 fathers experience depression or anxiety after the birth of a child, and about 5 to 10% of dads experience PMADs. And if a mom is experiencing depression or anxiety, those rates increase to approximately 25 to 50%. So now we're talking about both parents that are dealing with these issues themselves are now trying to parent a brand new infant.
And then we have to think about the baby, right? How does this affect the baby if one or both caregivers are suffering PMADs or depression and anxiety? If it's in the pregnancy period, there is the babies can be born low birth weight, small head size, preterm births increase, and then once the baby is born, there can be difficulties bonding between the caregiver and child. Behavioral, cognitive, or emotional delays can show up by the 18-month mark, and then excessive crying or irritability. Research has found that infants whose mothers experience PMADs are more likely to present with more irritability, less activity, and less attentiveness, and demonstrate fewer facial expressions, which then leads to the mother's difficulty in reading her infant's cues and unable to respond to his or her needs. Research has also found a strong correlation between infant behavior, so their poor soothability and sleep behaviors, and maternal distress, which can negatively impact the mother's mood even further. So there's just this cycle of distress between the baby and the mom. And I did want to pull this up. This is from the Maternal Mental Health in Montana report that was done in October 2022, and it shows the death of women while pregnant or within 1 year after pregnancy. And as you can see, beyond motor vehicle accidents, suicide and substance use disorder are um, a really high piece of the death. And in a 2014 analysis of hospital discharge data, it actually revealed that a number of infants born in Montana with neonatal abstinence syndrome or neonatal opioid withdrawal syndrome increased 78% between 2012 and 2014, and that's relatively older data. So we can only imagine kind of what that looks like now. And then a recent chart review conducted within the Indian Health Service System on the Blackfeet Reservation documented that 44 out of 143, so 31% of women tested positive for opioids, and 25, so 17%, tested positive for methamphetamine at delivery. So this is, I don't particularly, but I could probably find it. Um, and this data seems really, I mean, it is very alarming because we do need to notice that suicide and substance use disorder are really high, but the actual number of deaths is not like 500. It was 14 or something. Yeah, 12 or 14. But it does show, what are the causes. So it wasn't a whole bunch of women. Yes. Yes. Yeah. I will look into it. I will look into it. All right, so we can't, of course, talk about PMATs without talking about substance use.
An estimated 1,300 individuals with substance use disorder give birth annually in our state. So fewer than 100 will receive treatment. So obviously that is a population that we need to be looking at a little bit closer because that's a lot of people that aren't receiving the treatment that they need or the care that they need. So I pulled this figure because one, I think it's a great representation of what women go through in the process of giving birth, just in general, what's happening in their bodies. But really, what it can show you is that pregnancy can be a time of healing, but postpartum is the most critical time for relapse for women. So as you can see here, we have a couple different hormones happening. So progesterone, the hormone released that stimulates the uterus to prepare for birth, and estrogen produced early in pregnancy to support the baby, and then also later on to support breastfeeding, gradually increase as we are getting through these trimesters. And then once we hit that birth mark, the fall of those hormones are so drastic, and they really lead to a lot of different effects. Sleep difficulties, mood swings, anxiety, irritability, hair loss, and many more. And really, that all can lead into, again, another perfect storm for families to, be in a place where, it can lead very easily to relapse.
These are, again, kind of hard to see, but we don't want to leave out the connection of substance use disorder and trauma, kind of as Mulcair Jones had, brought forth. And so these are a couple of quotes. I'm just going to read them real quick. I cannot think of one pregnant woman I worked with that didn't have a co-occurring diagnosis. So this is a provider working with a woman that was a substance use disorder, had a substance use disorder, and was pregnant or parenting. That didn't have a co-occurring diagnosis. So a lot of major depressive disorder. I think every single one was probably, if I could look back in their records, qualifying as also having post-traumatic stress disorder, but also generalized anxiety, a lot of attachment difficulties, different caregiving role as a child, and maybe didn't have a consistent family member or caregiver present in their life. So that was just like a gamut of stuff that these moms are dealing with and have dealt with over their life. So that was a pulse and behavioral health provider. Another one said, I think that when we're working with pregnant women, I know that the topic here is kind of substance use or opioid use, but we have to recognize that it's often related to early childhood trauma, and we need to start having a discussion on how treatment supports, like you said, it's been tabled for so long in our world. It's kind of been like, what comes first, the chicken or the egg? Is it substance abuse treatment or is it therapy? And there is no answer to this question, and that was a Helma behavioral health provider. So just making sure we're always thinking about that trauma. So when women cannot achieve recovery alone, as we know. Pregnancy, this was another quote, pregnancy can certainly lead to motivation for change, but this is not something typically that people can do alone. To be able to say, well, I'm just going to stop. People usually need a lot of support in order to do that. But then you have to, pregnancy, then you have to pregnancy and you think, well, if I admit this now, then what? So what are our treatment options for these ladies? So of course, a complete medical examination, a psychiatric evaluation, self-help techniques, participation in support groups, talk therapy, medication, and/or hospitalization when necessary. So we're talking how are we going to support these women that do have PMADs. I thought it was super interesting. I learned at a perinatal mental health conference that thyroid imbalance and anemia are fairly common in the postpartum period and can contribute to feelings of depression and lethargy. So it's a good idea to actually check that because it can be actually a relatively quick fix. So I thought that was super interesting and had to share. So why are women not receiving treatment, either for substance use disorder, PMADs? So the leading causes are usually fear, lack of treatment, shame and stigma, or screenings aren't being conducted. There is shame and stigma associated with being a mother with an SUD, which come from both women's own communities, so family and friends, and/or the legal and medical communities with which they're interacting with. Not always, but it can. So let's dive a little bit deeper. Stigma, so stigma from someone else toward the person with the SUD. If they're feeling this stigma, it can definitely reinforce their self stigma that many pregnant women with OUD or SUD feel, especially in the context of traditional ideals of motherhood. And then the self stigma for a pregnant woman can also limit them seeking prenatal care or treatment during the prenatal period, which can then, of course, have long-term consequences for that child as well. And then, of course, there's fear. Another quote, there's definitely a level of fear if you're a mother, a level of fear of you don't want to get CPS involved in your case at all. And if you admit that you have a problem and you go seek help for this problem, you're automatically going to be on their radar. I think it is a big fear of people reaching out. So that was from a pulse and maternal health provider. So obviously the fear of admitting that you have a problem. So we're not seeking treatment. And then fear of getting your child taken away. Okay, so we do say like, hey, I have a problem, I need help. What does access look like for these women? So overall, Montana has a lack of treatment providers across the board. And on top of that, a lack of providers that have programs for perinatal women. So only 1 in 7 of Montana state-approved treatment providers reports having programs for pregnant and postpartum women. And then, so are these women getting screened? There is a lot of providers that do screen women, but as far as we look at Montana as a whole, it is not universal. So 1 in 5 women are never asked if they are using any sort of illicit drugs during either while they're pregnant or afterwards. So that's good to know.
So, we want to talk about screenings, and I know a lot of you guys work with a lot of different screener tools, and so this is probably not news to you, but some common screening tools are going to be the Edinburgh Postnatal Depression Scale. That's probably one of the most common ones that you'll see. The Edinburgh Postnatal Depression Scale is a screening instrument that was most commonly used to identify with women with mood disorders. So this 10-item questionnaire has been validated or validates in many different populations, and is an elevated score on this scale doesn't obviously diagnose, but it leads to asking more questions for this parent. And then the patient health questionnaire. The patient health questionnaire is a 9-item questionnaire used to screen for depression and monitoring changes in signs and symptoms of depression. So this questionnaire really should be considered just as vital as taking, somebody's blood pressure or their temperature, because, it's always a checking back. I saw you 2 weeks ago, or 6 months ago. How are you doing still? What else can we look into? Some other screeners that you can also dive into that focus on particular areas would be anxiety, domestic violence, substance use disorder, alcohol use disorder, suicide severity, successful or stressful life events, and mood disorders. So then we really want to talk about when can these screenings take place. So our recommended screening intervals in the prenatal area would be on intake, and then your second and third trimester visit. Postnatal are going to be the 2 weeks checkup and the 6-week checkup. And then the pediatric kind of well child checks, 2 to 4 weeks, and then the 2, 4, 6, 9, 12 months visits. So we really can be reaching these families in a number of different opportunities. Okay, so we've talked a lot about, what families can do, or, significant others, and what mothers can do, and what providers can do. And I really want to show you this video. It really kind of just demonstrates, this kind of mantra for families to take with them, to let them know that they have the power to also speak up when they are feeling like something's wrong. So this is a campaign out of LA County, and it kind of just demonstrates a little bit more about, bringing some light to the situation. So if we can switch browsers.
Big money, no whammies.
I love technical support.
My name is Raul Martinez, and unfortunately, my wife Kelly died because of the complications of postpartum depression.
I'm Jessica Cushman, and I had really bad postpartum depression. I never would have thought it would be something that would happen to me.
My wife was a health nut at all times, and especially when she got pregnant.
I didn't even have morning sickness.
I loved all the different changes that were happening in my body.
We know about 15 to 20% of women will suffer a perinatal mood or anxiety disorder, and that's about 1 million women nationally.
I knew about postpartum depression, and I knew to look for those symptoms, but I thought they were depression.
I would have these horrendous heat flashes. I wasn't prepared for how bad the sleep deprivation was. My issue was anger, a sense of despair.
And then I would lay down and my heart would start racing and my thoughts would start spinning.
What I noticed was that it kept getting worse.
The baby blues lasts about 14 days, but a perinatal mood or anxiety disorder goes on much longer. It can affect the baby, it can affect the family, the marriage, and that's why it's really important to get help early on.
My name is Vanessa, and I encourage you to speak up when you're down so that you can get the support that you need and really enjoy that period of your life.
It can be that motherhood that you dreamt about.
Don't stop asking for help until you find someone who will listen.
I want to hear about it and I want to help you.
I want to encourage you to speak up when you're down.
Because this is going to pass.
If I could say one thing to Kelly right now, it would just be that I love her and I miss her. And I hope she's proud of the job I'm doing with our daughter.
It's important to speak up when you're down.
Speak up when you're down.
Speak up when you're down. I encourage you to speak up when you're down. It doesn't have to hurt.
Speak up when you're down.
Speak up when you're down.
Speak up when you're down.
My name is Karen Post, and we want you to speak up when you're down. It's not your fault, and with the right help, you can get better.
You get to be a mom, and it's amazing.
So I just really love that video. I think that it really encompasses a lot for families and just being seen, but it also kind of gives them a voice. So, yeah, perfect. So now I want to give you some tools. I want to give you not only just supports and resources that are in our area, but all over nationally and further. So. So if we look at this like graph here, we can really see how support systems can be really holistic around parents. So first off, I just want to highlight, healthy habits. We all know that, proper sleep and nutrition and exercise and medication if needed can all be huge, huge support systems for families. Community support, so schools, friends, families, faith, therapy, parenting classes, childcare supports, and perinatal care are all huge, huge pillars in how to lift families up. But if you look at this graph, you can kind of see how it's got layers. So the social connections, community programs, labor and delivery, medication, crisis support, and then policy advocacy kind of loops all of that around in a couple of different things. And I just kind of want to highlight this that, regardless of whether or not personally or professionally you fall into one category, you probably fall into another category in a different situation or another category in a different situation. So I'm really kind of looking at how you play a role in people's lives is really important. So this slide here, a tool that I want to offer up for you guys, and if you scan this QR code, if you can, is a maternal well-being plan. So I think that this should be a really helpful tool for you guys and parents and families just to really plan ahead for situations that they might not know that they're going to encounter, but it's better to be safe. So planning ahead. So these are all just kind of questions where they have a sheet where they can kind of fill this out and have it on them or in the nursery or, in the kitchen where they can access this very quickly. So that's a place for me to relax at home, healthy, easy foods that I like to eat, people that I know that I can ask for help. And then we can kind of move into this just in case, who knows? My early signs that I'm feeling bad, depressed, or anxious are if it can be difficult to talk about not doing well, but who are my 3 contacts that I know that I feel comfortable enough to talk to them? And then what will you say? Helping giving them a script so that they don't feel like they're going to miss anything. And then we want to move into the get help section where we are going to be actively troubleshooting before they needed it. So getting help. If it's not an emergency, but you still need advice. So making sure that you have providers' contact information, both daytime and nighttime, to access. LIFT's pregnancy, postpartum support warm line, that's their number. Mother baby program warm line, that's their number. And then obviously we want to be extra careful. If it's an emergency and I'm scared, I will be hurting myself or my child. Call 911, crisis hotline. That information is at their ready. So that is a good tool.
I've done it.
I've broken it.
It's my fault. It's me, not you.
All right, so some simple things to do for new moms in your life. We really want to offer and offer help. And then again, I love giving people dialogue. So ask, so we can kind of dive a little bit deeper. I notice you're having trouble sleeping even when the baby sleeps. What's on your mind? Watch the baby while the mother gets some uninterrupted sleep. Listen, I really want to know how you're feeling, and I'll listen to you. Open the line of communication. So offer support. How can I help? I can take some of the work off of your shoulders, like making meals or cleaning or going to the grocery store. Let her know that she's not alone and that you're here to help. And then offer help. I'm worried about your mental health. Would you like me to help you find support, like a mental health provider, local resources, or do you need a suicide prevention lifeline? Ask her to let you help her reach out for resources. Um, and that kind of goes along with that whole person. Perfect. Okay, so some local resources. This is not a whole list. This is just a snippet of what Butte has to offer or surrounding areas have to offer. And so if you're not on here, please don't feel like we left you out. But this is just a bit. So public health systems. So we have home visiting models, WIC and lactation consultants, the Southwest Montana Community Health Center. I'm just going to kind of bounce around because it's a lot. St. James Healthcare, primary care providers, community support systems in Dillon, peer support networks, some nonprofits, Butte 4Cs. I work there, so I'm not like self-promoting, but and then also the New Hope Pregnancy Clinic, some support groups, the New Moms Group and Circle of Parents, and then mental health care. So we have the resource guide, but then we also have the mental health services chart, which you can pick up at the office. We try to keep as updated as we possibly can. And then also St. James Hospital has specific OB services, like a new IBCLC support, which is huge because we didn't have that for a while, and that was a huge lack. But we're really excited that we are still growing every single year. So some resources outside of Montana, because obviously we know that Montana, it goes along with isolation. We might not have the resources here that we, can find elsewhere. So Postpartum Support International, PSI, really deals with a lot of training, warm lines, psychiatric consultations, the Selene Institute, training, education, and maternal mental health. 2020 Mom is a national organization with a mission of closing gaps in maternal mental health. LactMed is a drug and lactation database that is available both online and in an app. And then Postpartum Stress Center, which is resources for clients as well as professionals. And then incredible cartoons that raise awareness for postpartum stress. And then, of course, the Suicide Warm Line, 1-800-273-TALK. Cool. So, as we're kind of closing out, we want to just leave you with a couple of takeaways. I know we kind of blurted at you for quite some time. But first off, I just want to say that PMADs are common and they affect approximately 1 in 7 women nationally.
Screening women is so important.
PMADs are the #1 complication of pregnancy and birth.
About half of women who experience these disorders don't receive the treatment that they need.
And SUD and OUD are common in Montana, including pregnant and postpartum women.
Treatment and support for women experiencing PMADs and/or SUD/OUD is a very complex issue that we just need continual support and work around. Here's some of our citations. We are not experts, however, there are many experts out there and we are so blessed to have them. These are great publications if you would like to learn more. Are we like way over time?
No.
Cool. It's like a time warp up
I
there.
made a giant QR code for that well-being on the next slide if you want.
Oh, did you? Okay.
Yes.
Are you ladies aware of the Mother Love podcast that Healthy Mothers, Healthy Babies? Yeah, so just putting in a plug there. I think for some of us that do a lot of driving or, find ourselves with our headphones in a lot, the Mother Love podcast has been created to kind of debunk the stigma and to tell stories. We know that part of telling story is trauma healing. So if you're a podcaster, Mother Love, Healthy Mothers, Healthy Babies.
There's also a magazine that they put out that has really great stories. Yes, we have so many of them. Please, if you want some, that just helps tell the stories.
Especially with new mothers, having that time with the father, with the child, for that bonding time, or seeking out that treatment that's not going to have that stigma, where if you take time off of work, oh, I'm, receiving treatment, that's something that you have to, be vocal about. This is just, it's incredibly frustrating that this is not seen, and I feel like mothers especially receive some of the lowest care when it comes to going to the, and I'm not saying like around here, because I know CHA and St. James are incredible with the help provided for pregnant moms, but it's just, again, there's a stigma with being a mom, or especially a single pregnant mom, receiving care from a provider. So,
Yeah. No, and I just want to, to that point, it's so, so true. And I wanted to pull it back to that like big circle graph thing. And the outer area is policy and advocacy. Really to make huge system change, it's got to be a group effort to kind of advocate for the change for sure.
Not specific data on it. However, it's definitely a trauma source, right? And so you can definitely suffer PMADs, and even they have a little bit of data that I've found that even like foster parents getting a new child can suffer PMADs. It's very compelling. But yeah, I think that definitely is very impactful.
Yes. No. So that's a huge, huge thing is that there are parenting classes out there that help give parents tools, and the Butte 4Cs is just one of those places that you can get parenting classes. They're totally free, and for parents they can sign up, and I think that we might see low attendance to those classes for a couple different reasons. Maybe that stigma part of it that I'm not in trouble with CPS, so I shouldn't be referred there. But anybody can go and take those classes. It's really just coming into the building, asking what classes are going to be coming up, and then or calling the office and signing up that way. But yeah, they're free and accessible to anybody out there that want to take them. There's a couple of different parenting classes that we offer, like Circle of Security, Positive Parenting. Sarah is one of our local experts. But positive parenting is, yeah. Cool.
I do think there has been an uptick in dads actually attending our parenting classes. I know that for sure, which is super cool to have that population, and they've really become kind of a network, which we know is so important. You can't, isolation is really hard. I don't know about the PMAD side of that. I can't speak to that.
Definitely. We love home visiting. I just
We love home
glanced
visiting.
over it, but the Healthy Families Network is amazing. Do you want to talk a little bit more about the Healthy
Or do you
Families
want me to?
Network? Or
Go ahead. So, home visiting is amazing. At the Butte 4Cs, we have Safe Care, and then at the health department, we have Nurse Family Partnership. We just have a new provider. So she can work with women who it's their first pregnancy, yes, and it's conception to 2 years. And then we have a couple different Safe Care home visitors within our building. And if you aren't familiar with home visiting, it's an amazing program. It's somebody coming into the home and just supporting that mom around parent-child interaction, safety in the home. They give car seats. I mean, it's just wonderful. And I'm like, I wish I would have had somebody to come in and be like, I'm here to help you. Because it's hard. So yes, if you want any more information on visiting, please call the Butte 4Cs. We have referral papers, whatever.
we're also on Connect, which all of you should be on Connect as well. So just so you know.
What else can we get in there? All right. Well, thank you guys so much.